Breathing. It's nice. It keeps us alive, but it's also something we never notice and completely take for granted. I mean, this is a good thing because who wants to think about breathing? I mean, we do it every couple seconds. Well, if you have asthma, you think about breathing a lot. Sometimes you think about every breath you take. And sometimes breathing is the hardest thing to do when for everyone else it should be easy. According to the CDC, 1 out of every 12 people has asthma, and that number has continued to grow over time. So chances are you know someone affected by this. And this isn't something to take lightly. For example, in 2007, 3,500 people died because of asthma, and every year, half of everybody with asthma is hospitalized because of an asthma attack. Myself, I have had 2 asthma attacks, both when I was a kid, and I had to be hospitalized for them both. So I know what this condition is like. I have medication that can control it, and that allows me to do pretty much everything I want, but it's still a pretty big burden, and I really can't be too active without my inhalers. So asthma is a chronic disease that's still not completely cured or understood despite the amount of people it affects. Right now I'm going to talk about what causes asthma, what asthma does to the body, and what we can do to control it. So first, to understand this disease, we must know what causes it. The exact cause is still not known, but there are many factors that influence the chance that someone might have it. The first area that usually gets a look with chronic diseases is genetics. So expectedly, if your parents have asthma, you might get asthma. Another factor to consider are the environmental factors, meaning that they're caused by, outside factors that they can be prevented. These include respiratory infections and exposure to airborne irritants while the immune system is still developing. And I think that's actually how I got my asthma. And asthma may not have a defined cause yet, but we do know it actually triggers it in those who have it. That includes just irritants in the air such as tobacco smoke, pollen, and other allergens. Another thing to look at is, when you get the flu, your asthma might flare up, and when you exercise, it flares up. I've had my asthma triggered by all of the things I just listed. So now that we know a little bit about how asthma might be caused, we can look at the effects and symptoms of this condition. The CDC actually has a chart which lists the levels of asthma intensity consisting of 3 zones. The green zone is the first stage, which basically means everything is going as normal and you have no effects of your asthma. The yellow zone is the second stage, and it describes the most common symptoms of asthma. Here you'll cough, wheeze, experience shortness of breath, and a tight chest. You can do some of your activities, but you might be pretty limited. When I'm exercising and my asthma starts to flare up, I have to either stop or use my inhaler. Okay, so the third zone is called the red zone, and this is pretty much as bad as it gets. You just take everything from the yellow zone and magnify it. You can't really do anything because you can't breathe. Your medication won't help here, and if they don't go away after 24 hours, you should seek medical attention. So finally, we can talk about the most important part of asthma, how to control and treat it. There are many medications capable of controlling asthma for both short-term and long-term, but there's still no cure. So the main long-term asthma controllers are called inhaled corticosteroids, and they're administered through an inhaler and work gradually over time to open the airwaves. This is mine, actually, right here. It's been prescribed by a doctor. You can't get it any other way, and you take it just like normal medication. I take mine once in the morning and once at night. This is not a rescue inhaler, and it won't prevent sudden symptoms, but it does, as I say, work over time to alleviate those symptoms. So the other kind of medication is called short-term, which is also known as a rescue inhaler, and that will alleviate your symptoms once you get them. And I do have one of those, but I don't ever need to use it because my long-term works so well. So now that we know pretty much everything about asthma, we know that it's a pretty tough disease, and it's a pretty big burden on those who have it. In fact, some people can't even afford the medication, and I think that's probably where most of the deaths come from. So if this could get cured, that would just be amazing.